My name is Tessa Hartsell, and I'm going to be doing my assessment on my willing participant, Jeffrey, who is over the age of 18. I'm first going to start with the inspection of the upper extremities. I'm going to just have you lift your arms. And during this time, I'm looking at the color and the texture of his skin. I'm also feeling the temperature with the inside of, or the outside of my hands. Checking the texture with the pads of my fingers to make sure there's no difference. I'm looking for any lesions on the skin, and also feeling for hydration and also for skin turgor. You can do this by checking, by just pinching up a little bit of skin and make sure that it retracts. Another good place to check skin turgor is here on the chest, where you can also pinch up, and you just want to make sure that it retracts pretty quickly. After you do your upper extremities, you do the same thing pretty much for the lower extremities. You feel with the same part of your hand down both the extremities. Make sure the texture and temperature and everything is the same as they should be. You look for any signs of edema. You can push down on the skin, and if you see any indentation, depending on the amount of indentation is how you would grade the edema. But you would do that for the feet too. But just making sure that the color of the feet and the legs and temperature are all the same. You also look at hair distribution to make sure it's evenly. That also shows that there's good circulation, which his is even on both sides. When you're looking at the legs, another thing you look for is any veins, spider veins, varicose veins, anything of that nature, which none are visible on either of his legs. The next thing you want to inspect is the nails. This can tell you a lot about the person's hygiene, and if there's any decrease in oxygen, if there shows any signs of clubbing. His nails look good. If you can put your two nails together like this, and his looks pretty normal there. The nails are clean, they're firm, they're well taken care of. Alright, so that's his nails. Next, I'm going to move to the head. When you're looking at the head, you want to look at the color, at the texture, make sure everything is symmetrical. He does not have a lot of hair to actually look through, but you would want to look at the scalp for any dandruff to make sure that it is moist and everything. And there's no lesions on the head, and you let me know if you feel any tenderness when I'm feeling your head. But you just want to make sure that everything is symmetrical with the head. And the scalp. Any tenderness there?
No.
If he did have hair, you would want to look at the texture of it. That can tell you a lot about the person's nutritional status and hydration status. Which we don't have that in this situation here. Next, I would look at the sinuses. Do you feel any tenderness at this point?
No.
All right. And now I'm going to test your jaw. I'm going to look for TMJ. I just want you to hold your head just like that, and I want you to open your jaw and then close a couple more times. Any pain?
No.
Okay, I feel no clicking or anything, and he doesn't experience any pain there with that. Next, we're going to check your a couple of your cranial nerves with your face. I want you to blow out your cheeks. Okay, I want you to stick out your tongue, smile, frown, and purse your lips. Perfect. All right. And right now I'm going to scan the room. And here is my willing subject participant. Here is my table with all of my supplies that we will be using. There's nothing on either one of those papers, just so you can see that. TV, and then this here is what everything is sitting on. Alright, we're going back to my subject here. Make sure everything's straight. Perfect. Alright, next we're going to be looking at the eyes, and I'm going to discuss the Snellen chart. What the Snellen chart is it tests for distant vision, and what you would want you to have your patient do is you would have the chart in front of the patient, and the patient would be positioned about 20 feet away, and there's a set of numbers, and your patient would look from left, read from left to right, starting at the top and going down to the smallest number where they could actually visualize those letters, not numbers. And that checks for the distant vision, and that's called the Snellen test. The other test is called the Rosenbaum test, and this checks for your near vision. And in this test, what you would have the patient do is they would have a card, and they would be reading the card with one eye covered, read the card, and then same thing with the other card. And at this point, they would only be holding the paper like 12 to 14 inches from their face. So he did those, and he did those successfully in checking those visions. Next, we will look at the confrontation, and what we do is I'm going to have him cover his left eye, and I'm going to stand in front of him and cover the opposite eye of mine. And I'm going to have a pin light, and you tell me when you see this.
I see it.
And down from below.
I see it.
And from the side.
I see it.
Perfect.
I see it. I see it. I see it.
Perfect. All right, I will take that from you. And now I'm going to do the 6 cardinal fields of gaze, and what I'm going to have you do is just look straight ahead, and I'm going to move the pen, and during this time you only move your eyes. You just focus here on the pen and just move your eyes to follow the pen. Then we'll come back to the center. Perfect. All right, and that is another eye test. Then we're going to do the cover-uncover test, and what I'm going to have you do is look straight in front of me, and I'm going to just have you sort of focus off into the living room, like towards the fireplace, and I'm going to cover one eye and then uncover it. And what we would expect to see is your vision still focused ahead, your gaze still focused ahead, okay? So just sort of look over my shoulder towards the fireplace. And it does, and we're going to test this other eye, and I will do this a couple of times on each eye. You can blink if you need to.
Okay.
Perfect. I'm going to palpate your eye, and you tell me if there's any tenderness along the bottom of your eye. Another good thing to do is to look at the texture of the eyebrows and make sure the eyes are symmetrical, the eyelashes, the eyelid. Look for any exudate or any signs of infection in the eye, which he doesn't display any. His sclera is white. There are a few blood vessels noted, but not many at all. And you can see that everything is symmetrical with his eyes. Next, we're going to move to where I'm actually using the ophthalmoscope to look in the eye. So we're going to get this ready here. Get it turned on, maybe. I think that's just working. That's not now. With the ophthalmoscope, I'm looking at the globe of the eye, looking back at the blood vessels to see if there's any redness or blood vessels. Just look straight ahead. Okay. Perfect. Perfect. This is how they check for macular degeneration in the eye. Also, going back to the eye, you also want to make sure there's no drooping or lag lid of the eye, and we do not see any of that there. The eye color is the same. Everything looks symmetric with his eyes. I'm going to scan the room once more. Still the same supplies. That's off towards the fireplace that we were asking him to look at. The couch. Once again, participant. Set it back down. Finally, we're going to move to the inspection of the ears, and going to look at a couple different things. On inspection of the ears, you of course want to make sure they're symmetrical and that they're aligned correctly and evenly throughout the with the eyes, with the pinna of the eye. You want to sort of feel the outside of the ear. Do you feel any discomfort?
No.
There with the ears. Look to see if there's anything that may interfere with you actually viewing the inside of the ear as far as drainage or anything, which I do not see any of. I'm going to get my otoscope ready. And at this point, what I'm looking for is I'm looking into the inner ear to see if there's any drainage or swelling. Okay. And what you want to do with the adults is just sort of pull their ear up and back. And the tympanic membrane is like a grayish color. You should see a light reflex. The left ear about 7 o'clock. Same thing, you can see and then the right ear about 5 o'clock. Alright. That is checking the inside of the ear and the inner ear. Next, I'm going to perform the Weber test, and what this test is what I'm going to do is I'm going to activate this, and I'm going to put it in the center of your head here, and you tell me if you can hear it better in the right ear, left ear, or if it's the same in both ears, okay? And we're going to do that now.
The same.
Same. And when you're doing this test, it's best to hold it down at the base and not to touch this, because that will sort of deactivate it and interfere with your test. The next test is the Rhine test, and what this does is it tests bone conduction versus air conduction. So I'm going to do the same thing. I'm going to activate this. I'm going to hold it to the back of your ear here. When you no longer hear it, I want you to just sort of raise your hand and let me know, and then I'm going to move it to the side of the ear. And you should hear it with air conduction. You just sort of let me know when you no longer hear it, okay? Just raise your hand when you no longer hear. Do you still hear it?
Yeah.
So, and the goal is for you to hear the air conduction about 2 times longer through air conduction versus bone conductions, and you would repeat this on both sides. All right. So that's testing your hearing. I'm next going to do the whisper test, and what I'm going to do is I'm going to stand behind you, and I'm going to whisper something in this ear, and you just repeat what I whisper to you, and then I'll do the same with a different comment in your other ear, okay?
It's cold outside.
All right, I'm going to go to this side.
Okay. Christmas is coming soon.
Perfect. All right. Next, we're going to look at your mouth, and this can tell you a lot about your hydration status and everything. And we want to make sure that it is midline. I want to inspect your tongue, and so what I'm going to have you do is stick out. We'll put some gloves on. And what I'm looking at your teeth, your gums, your tongue, to inspect all of the above. All right, just open your mouth and stick out your tongue. So you're just looking at the tongue sticking out. Perfect. You want to look at your gums here for any sores. And the teeth are straight and well taken care of. We'll have you stick out your tongue. Perfect. No sores or anything noted there in the tongue. You can also check the gag check the gag reflex also, which is important for patients coming out of surgery. You want to make sure that their gag reflex is intact before offering them anything to drink. And finally, we're going to look at the neck. I'm going to take my gloves off here, and we are going to look to make sure everything is symmetric, and it is. We're going to make sure your range of motion is good. I'm going to have you just turn your head to the right. Any pain? Turn your head to the left. Touch your chin to your chest, and then move your head back there. Okay, perfect. And then I'm going to check your cranial nerve 11, which is the spinal accessory, and I want to just have you shrug your shoulders first, and then I'm going to have you shrug your shoulders against resistance. Okay, perfect. And then I'm going to have you try to turn your head against resistance. Okay, and the same thing for that side. Perfect. Now I'm going to feel your lymph nodes. When you are testing or feeling for lymph nodes, you want to do it in circular motion, but not too firm, as then it would push it down into the muscle and it would make it harder to palpate. So just start here. 1. And you're feeling for any nodules or hardened places. You just want to do it bilaterally and symmetrically to make sure that there's nothing failed. And your cervical chains here, looking for things here. Nothing has failed there. Next, you would want to inspect your carotid artery, and your carotid is located right under your chin, your mastoid process, and a lot of times you can visualize the carotid artery pulsating, but you can also palpate your carotid artery, and you can listen to it with the bell of your stethoscope. And I will do that in just a moment, but I'm first going to go to the thyroid gland, which to test the thyroid gland, you just sort of feel along the neck down the trachea. And a lot of times the thyroid gland is hard to palpate. What I'm going to do is have my patient take a sip of water, and sometimes you can sort of feel it better when they swallow. One more time. Perfect. And another way you can also test, I'll put that back there for you, test the thyroid gland is to sort of have the patient tilt their chin down a little bit and a little to the right. You would just, you can see if you feel swallow for me. All right. And you can listen to the thyroid, and I'm going to do that and listen to the carotid at the same time. And I do that with the bell of my stethoscope, and you would do this bilaterally. And same thing with the thyroid, you can swallow. And when you're doing this, you need to always let the patient know if they feel any pain or discomfort during any part of the exam to let you know at the time so that the exam can be stopped. And going back, I realized I had my pen light and I forgot to do one thing with the eyes. So what I'm going to do now is I'm going to check his reflex and make sure that his pupils show. And what I need to dim the lights just a little bit. Well, alright, I just want you to stare straight ahead, and all I'm going to do is bring the light in and just make sure that your pupils respond to the light, okay? So just stare straight ahead. And they do. His pupils are about 3 millimeters. And they respond. They are consensual to light. Perfect. It's a little darker than it normally would be, but. And finally, going back to the nose, I'm going to test the olfactory cranial nerve, and I just want you to close your eyes, and I'm going to put something under your nose, and this is testing one of your cranial nerves, the olfactory cranial nerve, and you just tell me what it is that you smell.
Lemon.
All right, perfect. All right, and that concludes my assessment of the head, neck, ears, eyes, throat, and upper and lower extremities. What do I hit?
The PowerPoint.